Good morning, friends. I hope we are live now. Can you see me? Good afternoon, friends. I hope now you all can see me. So today we are going to start. So today we'll start with the drug of choices for various diseases in pharmacology. The first question that I have for you is drug of choice for heparin-induced thrombocytopenia. The first question, drug of choice for heparin-induced thrombocytopenia. Let me know the answer. Let me know the answer in the comment box. Answer correct, ergotroben. Prachi Gold correct. Answer is ergotroben. So for heparin-induced thrombocytopenia, the drug of choice for treatment is the direct parenteral, the direct parenteral thrombin. Direct parenteral thrombin inhibitors. And there are three drugs in this category. One is lepirudin, another is bivalirudin, and third is ergotroben. So these are direct thrombin inhibitors which are parenteral, which are injectable. That is the word you want to remember, parenteral. Now if you are asked drug of choice amongst these three also, then please remember ergotroben is the best amongst these three also. Amongst these three also, this is the drug of choice, ergotroben. So this is the drug of choice for heparin-induced thrombocytopenia. Next question we have drug to immediately reverse the effect of oral anticoagulant is. Immediately reverse the effect of oral anticoagulant. Let me know the answer. Immediately reverse the effect of oral anticoagulant. Second question. I hope Shubham the voice is clear now. Drug to immediately reverse the effect of oral anticoagulant. When oral anticoagulant is written, nothing is specified. Look for warfarin. Look for warfarin. So answer I'm getting from Prachi is C. Phytonadione. Rahul Soni says B. Protamine sulfate. And Rahul Soni 84 again says A. Now you see this is a very good question. The word immediately is important here. Now two questions are asked. Warfarin, we have warfarin overdose, and you are asked drug of choice or to reverse the effect of warfarin overdose. Answer is vitamin K1. K1 is phytonadione. Phytonadione is the vitamin K1 and it is drug of choice for warfarin overdose. To reverse the effect of warfarin, what it will do, it will increase the synthesis of clotting factors. So students, vitamin K1 or phytonadione will increase the synthesis of clotting factors. But this will take time. Clotting factors will not increase immediately. So this will be slow. So if you are asked to reverse the effect immediately, the word comes immediately. So if you have to reverse the effect immediately, then you will not wait for this vitamin K1. You will give either prothrombin complex concentrate or fresh frozen plasma. Whatever is given in the option, prothrombin complex or fresh frozen plasma, as is given in option number A. What are these? These are immediate source of clotting factor. They are immediately going to reverse clotting factors 2, 7, 9 and 10. So immediately if you want to reverse the effect of warfarin, prothrombin complex or fresh frozen plasma, this, and if drug of choice is asked, vitamin K1, but that will take time, that will be slow. So please read the question very carefully. Please read the question carefully. Immediately reverse prothrombin complex or fresh frozen plasma, both are immediate source of clotting factors 2, 7, 9 and 10, and vitamin K1 is the definitive antidote or drug of choice for warfarin overdose, but that is going to act slowly. So that is why this question answer in this form is prothrombin complex. So read the question carefully about warfarin. Next question. Question number 3, drug of choice for fibrinolytic overdose. Question number 3, drug of choice for fibrinolytic overdose. Fibrinolytic. Now when I say fibrinolytic, which drug comes to your mind? Which drug comes to your mind? So we have to consider it could be drugs like streptokinase. It could be drugs like streptokinase. It could be drugs like alteplase. So these are fibrinolytics. You are asked drug of choice for treatment of fibrinolytic overdose. So let me know. Let me know the answer. Drug of choice for streptokinase or fibrinolytic overdose. Yes, Prachi, Shubham, Rahul, Asrar Ahmed. These are all important questions for the upcoming FMG examination. As such, the questions will be asked. So what is the drug of choice? You see, what do these fibrinolytics do? Fibrinolytics, these are also known as their mechanism. If you understand, they are going to break fibrinolytic. So they break fibrin into fibrin degradation products. They will break fibrin, and this was done by the enzyme plasmin. Now, plasmin is present in our body in the inactive form. As plasminogen, and these drugs convert plasminogen into plasmin. So actually these drugs are nothing but plasminogen activator. These drugs are nothing but plasminogen activator. So we have the drugs like tranexamic acid, which are inhibitor of plasminogen activator. Tranexamic acid is inhibitor of plasminogen activator or streptokinase. So this is the antifibrinolytic. Antifibrinolytic. These drugs are known as antifibrinolytic. Antifibrinolytic. Tranexamic acid. If tranexamic acid is not given, you can also look for epsilon aminocaproic acid. This is also a drug same as tranexamic acid but short acting. Epsilon aminocaproic acid, that also you can look for. So fibrinolytic overdose, please remember, if you have overdose, it would result in bleeding. It would result in bleeding, and you are talking about drug of choice for treatment, antifibrinolytic. So please remember tranexamic acid or EACA, they will stop bleeding. They will stop bleeding. So these are the drugs which are used to stop bleeding. Tranexamic acid is the most important, or epsilon aminocaproic acid, plasminogen activator inhibitor, also known as antifibrinolytic. So that is the drug of choice for fibrinolytic overdose. Many times this question has been asked. The next question that we have, drug of choice for acute iron toxicity. So patient has taken, mostly it happens in children, and he has taken more than 10 to 20 tablets. He has taken by mistake more than 10 to 20 tablets of iron. So that is where we present, or the patient presents with acute iron toxicity. So friends, please understand this scenario in which acute iron toxicity, patient is mostly a child who has taken by mistake many kinds of or many tablets of iron, many iron tablets he has taken, and he has mostly GI hemorrhage. The symptoms include mostly GI and hemorrhage, and in liver there can be necrosis, and then there can be CNS damage or brain damage. CNS disturbances can occur. So this patient is presenting in emergency with GI hemorrhage, falling BP. What is the drug of choice? What is the drug of choice? Drug of choice for acute iron toxicity. Question number 4. Question number 4. Nadir says, Shubham says, Rajwal Mani, everybody says A. So A then has to be correct. So if we have acute iron toxicity, the antidote is desferrioxamine. So it is an iron chelator. Iron chelator. There are many iron chelator. Desferrioxamine. Desferrioxamine is the drug of choice. It is given either subcutaneous. It is given mostly in this case subcutaneous. It is given in thalassemia. It can also be used in thalassemia where we give it subcutaneous. In iron toxicity, please remember, in iron toxicity, desferrioxamine will be given mostly IM or IV. So the preferred route is IM. Preferred route is IM. Desferrioxamine is the drug of choice. Drug of choice in iron toxicity. The second question can be asked, which is contraindicated in iron toxicity. Tell me the answer. Which of these A, B, C, D is contraindicated in iron toxicity? What will be the answer if asked which is contraindicated in iron toxicity? Shubham, desferrioxamine is given, preferred IM. IV is given only if shock is present. Only if patient presents in shock, then you give IV. Okay. If question is asked acute iron toxicity, which of the following is contraindicated? Which of the following is contraindicated? Then what will be your answer? What will be the answer if this question is asked? Answer correct. Prachi and other both are correct. Answer will be ball. So please remember that ball is contraindicated. So you have British anti-leucide. British anti-leucide is contraindicated. AB. If we look at the alphabet, AB is followed by CD. So in cadmium poisoning it is contraindicated, and also after CD comes EF, AB, CD, EF. So F is symbol of iron. So in these two poisoning, iron and cadmium poisoning, ball is contraindicated. Simple way to remember, A, B, C, D, E, F. Ball is contraindicated in cadmium and iron poisoning. So that is about this particular question. Next is drug of choice. Drug of choice for chemotherapy-induced thrombocytopenia. Chemotherapy-induced thrombocytopenia. This is going to be a rapid revision session for the upcoming NEET and the FMG examination. All these drugs of choices are very commonly asked. If you have any confusion, please do not hesitate to ask. Please feel free to ask the query. Drug of choice for chemotherapy-induced thrombocytopenia. Thrombocytopenia is happening due to cancer chemotherapy. That means platelet count is going down. Platelet count is going down. Darbepoetin alpha, filgrastim, which is granulocyte colony stimulating factor, and trombopag, oprelvacin. ABCD. What is the answer? Answer I am getting from Prachi, Tanya, and Nadir. Prachi and Tanya are saying D. So that is the correct answer. If you have chemotherapy-induced thrombocytopenia, then you will increase the platelet by giving recombinant interleukin 11, and that is known as oprelvekin. Oprelvekin. So that is the answer to this particular question. Now, what is the confusion here? Confusion here is that there are two more drugs, Romi PLO platelet stim, Romiplastim, stimulator of PLO. If you make it just PLA plastim or Romiplastim platelet stimulator. And second is the drug which is written here, L thrombopoiesis stimulator. L thrombo peg. So there is no H here, but if we add H, it means thrombopoiesis. L thrombopeg. These two drugs also increase platelets. These two drugs also increase platelet. So why we have not taken L thrombopeg? Why we have taken oprelvekin? You have to remember that these drugs are used to increase platelet only in idiopathic thrombocytopenic purpura. They are used only for ITP. So romiplastim and L-trombopag, they increase platelet, but these drugs will be used for ITP only. These drugs are not used for chemotherapy-induced thrombocytopenia, where drug of choice to increase platelet is oprelvekin. So three drugs to increase platelet. One is used for chemotherapy-induced, and another is used for thrombocytopenic purpura. So please keep that in mind. Very important question. Very important question. Moving to the next. So Shubham, I guess now you understand why L-trombopag is not the answer in this particular question. Moving to the next question. Simple but very important, very frequently asked question. Very frequently asked question. Drug of choice for chemotherapy-induced neutropenia. So instead of thrombocytopenia, now we have neutropenia. Neutropenia. Very simple question. I expect everybody to answer it correctly. Everybody to answer it correctly. Options we have darbepoetin alpha. Darbepoetin alpha, option number A. Filgrastim, which is GCSF, option number B. L-trombopag, option number C. And oprelvekin, option number D. So out of these, the B is the correct answer. So these two drugs we have already seen. They increase platelet. We want to increase neutrophils, so that will not be the answer. Darbepoetin alpha is a type of recombinant erythropoietin. It's a type of recombinant erythropoietin, and it is used to increase RBC. So it will be used for anemia. So the correct answer is filgrastim. Filgrastim. So we have granulocyte colony stimulating factor, and we have granulocyte monocyte colony stimulating factor. Please try to understand. These are colony stimulating factor. Since they are stimulating factors, so their name ends with stimulation. Both the names end with stimulation, stim. Now before stim, we add whatever they stimulate, like granulocyte colony stimulating factor. It is stimulating granulocyte, so you will add only granulocyte. And this is granulocyte macrophages or granulocyte monocyte. So you will add both granulocyte and monocyte. Then prefix is given. One something is added which has no meaning. Filgrastim is GCSF, and you can add here SAR. Sargramostim is GMCSF. So these are two drugs. These are two drugs for chemotherapy, for cancer chemotherapy induced neutropenia. Neutropenia. Both the drugs are used for this chemotherapy induced neutropenia, number 1 and number 2. And suppose if both are given, then also this will be the drug of choice. This will be the drug of choice even if both are given. So this is the best drug, filgrastim. Filgrastim is the drug given by subcutaneous injection. Please remember, it is not oral, subcutaneous injection. Even if both GCSF and GMCSF are given, still the answer is filgrastim. So very important and very simple question. Next, this is a very clinically oriented question. Hyperlipidemia is so common in our population, and if hyperlipidemia occurs in pregnancy and a treatment is needed, then what is the drug of choice? What is the drug of choice for hyperlipidemia in pregnancy? Very clinically oriented and very important questions, and frequently students mark it wrong. So question number 7. Question number 7. Please let me know what is your preferred answer for this particular question. Yes, Mahesh, Shubham, Nadir, Mani, Tanya, Prachi. Please let me know. Please let me know what is the drug of choice for hyperlipidemia in pregnancy. Please go ahead. Please try. Even if you do not know, please try. So I am getting options B, cholestyramine, and B is the correct. Hyperlipidemia in pregnancy is treated with the acid, bile acid binding resin. Bile acid binding resin is the drug of choice for hyperlipidemia in pregnancy. Hyperlipidemia in pregnancy, there are three important drugs. You can have cholestyramine, cholecelvalam, and you can also have cholestyramine. So these are some bile acid binding resins which are used as drug of choice for hyperlipidemia in pregnancy. Please remember, other drugs like atorvastatin, they are contraindicated in pregnancy. Similarly, nicotinic acid is also contraindicated in pregnancy. You do not give these drugs in pregnancy. And if asked, bile acid binding resins are contraindicated where? Where are bile acid binding resins contraindicated? Very important questions for NEET PG. This question can come in NEET PG. In which situation? In which situation bile acid binding resins are themselves contraindicated? So Republic Bharat, Rakib, Logu, Mani, those who have joined recently, can you tell me this question? If asked, bile acid binding resins are contraindicated in which scenario? Where you will not give bile acid binding resins. Okay, so they are being used as drug of choice in hyperlipidemia in pregnancy, but where are they themselves contraindicated? Where are they themselves contraindicated? Where will you not give these drugs? Important question. Where will you not give these drugs? So you will not use these drugs, whether pregnant or non-pregnant. You will not use these drugs in a patient of hypertriglyceridemia. These drugs are not given because they themselves increase triglyceride. So if patient is having hypertriglyceridemia, his triglyceride level is very high, you do not give bile acid binding resin. But the current question, coming back to the current question, hyperlipidemia in pregnancy, what is the best drug? Bile acid binding resin. If bile acid binding resin is not given, then what you will look for? You will look for omega 3 fatty acid. If bile acid binding resin is not given, second drug of choice in pregnancy, second drug of choice after bile acid binding resin in pregnancy, omega 3 fatty acid. So hyperlipidemia in pregnancy, very important for us to recognize the importance of bile acid binding resin. Next, question number 8. Drug of choice for acute exacerbation of ulcerative colitis. Ulcerative colitis, a type of inflammatory bowel diseases. A type of inflammatory bowel disease, an acute worsening or attack or exacerbation of ulcerative colitis. What is the drug of choice? And your options are prednisolone, sulfasalazine, mesalazine, vancomycin. What are the options? So option number A is the correct answer for acute exacerbation. Option number A, steroids. Steroids like prednisolone can be given for acute exacerbation. Steroids are drug of choice. One of the best steroid is given is oral budesonide. Oral budesonide, if given, is one of the best steroid in GIT disorders like ulcerative colitis because it is least absorbed from GIT. So it will act in GIT, local anti-inflammatory action, but it will not be absorbed sufficiently, do not cause systemic side effects. So that is the answer. Now, Anshul has asked a question, sir, why nicotinic acid is contraindicated? That was related to the previous question. So please understand, Anshul, not just nicotinic acid, even statins are contraindicated in pregnancy. Most anti-hyperlipidemic drugs are contraindicated. The reason is that cholesterol or lipids are needed for synthesis of cell membrane. So if you give any drug that decreases the synthesis or the availability of lipids, it affects the synthesis of cell membranes in the growing cells of fetus. So that is why most hypolipidemic drugs are contraindicated in pregnancy. There is no specific damage with nicotinic acid, so it can lead to cell membrane damage and that can lead to muscle damage in the fetus. So coming back to question number 8, we have discussed steroids are drug of choice, particularly budesonide if given. Now the next question, drug of choice for ulcerative colitis. Now you are not given whether acute exacerbation or maintenance therapy. You are simply asked drug of choice for ulcerative colitis. Prednisolone is given, sulfasalazine is given, mesalazine is given, and vancomycin is given. So now what will you take? Now what will you take as the drug of choice? Getsuba, Tenso, sir, in UC, drug of choice in other condition than acute is. So I think we have presented your query as the next question. So you see, this is a very, very confusing question, very important and very confusing. What is the drug of choice for ulcerative colitis? So we assume that this is for long-term treatment. We have to make an assumption that long-term treatment is asked. Now the best drug, please remember, for ulcerative colitis is 5-amino salicylic acid. 5-amino salicylic acid is the best drug. It exerts local anti-inflammatory action. Now it can be given in two ways. It can be given in two ways. One is mesalamine. Mesalamine, also known as mesalazine. What is this? This is tablet of 5-ASA, tablet containing 5-ASA. Now, which is going to be coated? Which is going to be coated with some polymers. Some polymer coating will be done. Okay, polymer coated tablet. Now, this polymer coating is going to dissolve in pH which is greater than 6 or 7, around 6 or 7, that is at alkaline pH it will dissolve. So it will dissolve in lower small intestine, lower small intestine and colon. So it will deliver this drug 5-ASA to the lower part of GITs, lower part of small intestine and the large intestine, mesalamine. And the second way of delivering 5-ASA is the 5-ASA with some other compound, using which bond? Using nitrogen bond or azo bond. So this is the other approach. 5-ASA is combined with some other compound using azo bond, and we have 5-ASA combined with an azo bond with diazine, and this is known as sulfasalazine. So both are given in the option. Now what to take? Both are given in the option. What to take? So sulfasalazine, because of the presence of this sulfa drug, will cause a lot of side effect like fever, like joint pain, like even it can cause bone marrow suppression, decrease sperm count. So if both are given, please remember this is always the best drug. This is always the best drug. If this is not given, then look for azo compounds. Then look for azo compound. So please remember, a lot of you, all of you have answered sulfasalazine, but you did not read the question carefully on the option. Mesalazine was given, and mesalamine is the best drug. So I hope this is now clear that 5-way assay can be given in two ways. One is a coating, polymer coated tablet, which is known as mesalamine or mesalazine, and another is 5-way assay combined with some other using an azo bond like sulfasalazine. Now sulfasalazine comes with several side effects like fever, joint pain, sperm count decrease, bone marrow suppression. So best answer is mesalazine. Always look for mesalamine or mesalazine. So I hope this is clear. I hope this is clear. And the last question we have, drug of choice for lowering blood ammonia in hepatic encephalopathy. This is the last question. Answer is lactulose. Lactulose is preferred over neomycin. Over neomycin for lowering blood ammonia in hepatic encephalopathy. So that is the answer. Neomycin is not used because it causes atrophy. It can cause atrophy of intestinal villi. So that is the answer to this particular question. So that is the time we had for this particular session. That is the time we had for this particular session. Half an hour short session, and I have tried to tell you drug of choices for some very important from the examination point of view. These questions come as such. So these are rapid revision sessions. Drug of choices. We have another such session today evening at 7 p.m. for which link will be pasted. So I hope all of you liked this particular session and you found it useful. I am sure I have been able to clear a few of your concepts. So please keep coming back for more sessions. The information will be provided in the Unacademy Telegram group. So thank you, and do not forget to subscribe to Unacademy, download the app and subscribe to Unacademy.